This short video is going to focus on type 2 diabetes, what it is, how to reduce your risk, and the signs and symptoms to look out for. My name's Vicky and I'm a diabetes specialist nurse. Currently, there are about 4.9 million people in the UK living with diabetes, and about 90% of those have type 2 diabetes. It is also thought that there is about 850,000 people with type 2 diabetes yet to be diagnosed. So the first question we need to ask is, what is type 2 diabetes? So let's start with the hormone called insulin. Insulin is produced by the pancreatic beta cells, and it is essential. It helps to regulate blood glucose levels to keep them always within a normal range. It allows the glucose from the bloodstream, which we get from the food that we eat, to enter the body's cells and be converted into fuel or energy. Type 2 diabetes occurs when the amount of insulin being produced is not enough or it's not working properly. This then leads to rising blood glucose levels because the glucose is unable to get into the body's cells. High glucose levels over time can cause damage to the blood vessels and other organs within the body, and these are known as the complications of diabetes. Well, there are certain risk factors that make some people more likely to develop type 2 diabetes than others. And these include age. If you're white and over the age of 40, this increases your risk. But if you are from Black African, African Caribbean, or South Asian descent, being over the age of 25 increases your risk. Living with obesity or being overweight or having a waist circumference that's too big is another risk factor. Family history is also another risk factor. So if you have a parent or a brother or sister with type 2 diabetes, this increases your risk. Ethnicity is another risk factor. You're more at risk of developing type 2 diabetes if you're Black African, African Caribbean, South Asian, or Chinese. Certain other medical conditions can also increase your risk, and these include high blood pressure, heart attacks, strokes, or severe mental illness. So what can people do to reduce their risk? Well, approximately 13.6 million people currently in the UK are at risk of developing type 2 diabetes. And research has shown that in some people, dietary changes, increases in physical activity, and sustained weight loss can reduce the risk of type 2 diabetes by up to 50%. What are the signs and symptoms of type 2 diabetes? Well, quite often, rising blood glucose levels happen gradually over time. Therefore, some people might not notice these symptoms and others might not be aware of them. But the common symptoms to look out for are needing to go to the toilet more often to pass urine, and this can usually happen during the night. Feeling very thirsty, like they need to drink all the time and not being able to quench their thirst. Feeling more tired than usual. Having cuts and wounds that take longer to heal, and having recurrent skin or genital infections such as thrush. Losing weight without trying to is another symptom of type 2 diabetes. So if you are experiencing any of these symptoms, it's really important to make sure you see your healthcare team. So how do we treat type 2 diabetes? Well, essentially, the aim is to reduce blood glucose levels to try and keep them as near normal as possible. And this helps to reduce the risk of longer-term complications. There are several treatments we use for type 2 diabetes, and these include healthy eating, increasing physical activity, maintaining a healthy weight or losing weight if needed, and medications such as tablets, injectable therapies, and insulin. Quite often, people with type 2 diabetes will be on a combination of these treatments, and the requirements for medication may change over time. So how can people find out more? Well, there's lots of available resources out there for people diagnosed with type 2 diabetes or for those at risk of type 2 diabetes. And these include charities such as Diabetes UK, the Diabetes Research and Wellness Foundation, the NHS website, but also here at Leicester Diabetes Centre we have our own website with a section called My Diabetes. And for any healthcare professionals wanting to find out more about diabetes, we have the Eden Education website. And you will find the links to these resources in the description below. I hope you found this useful, and thank you for listening.